So hi everyone. So my presentation will be about the issues in terms of community-based organizations and the commitment to support them in the interventions and financing and sustainability of the community response to HIV. I will talk about the priorities, why we need advocacy, and then go on about some examples mostly brought from Thailand, where PrEP is implemented. The other two presenters have mentioned about PrEP and financing, and then I will also talk about examples in terms of self-testing policy development, where advocacy has been used to change that policy. And then can you go next slide, please? Yes, and then I will provide those examples and the results, and then give you some conclusions. Next, please. Next. Yes. So other colleagues have talked about the importance of community HIV response, and I'm repeating it just a little bit because this is the priority for the PEPFAR program, at least in Thailand and Laos, as well as in the region. In order to reach the 90-90-90 targets of UNAIDS and also achieve full PrEP access to the highest risk population by 2020, we need to expand KP network and KP and community-led approaches, and then strengthen KP organizations participation and leadership at local and regional level to sustain the HIV response. And also we would focus on helping countries to transition to self-reliance, and that means increase and optimize domestic investment for KP programming. And then I'm going to talk about why we need to continue advocacy. All of these are not easy, and we need more efforts in order to scale up, for example, the interventions such as PrEP and self-testing, particularly in countries such as Thailand. Next, please. So here, Heather Marie mentioned briefly about it, but I'm talking about how advocacy played out in the development of PrEP rollout in Thailand. So the CBO plays a very critical role in this PrEP service delivery, and hence is fundamental in reaching key populations. Here we showed you the example of the graph. You look at the blue, that is the result from the PrEP provision service delivery option at the public sector by 15% uptake. And when we look at the KP-led approaches in community sites throughout the countries, and around 9 sites funded by PEPFAR, we contributed to about 85% of the overall PEPFAR results on PrEP. For the whole country, we contributed more than half of the national uptake in terms of PrEP. So Thailand rollout of PrEP is while as at an advanced stage. We've done a lot of advocacy before we get here, and Thailand is about to include PrEP into the universal health coverage this year, but will be on a pilot stage involving about 2,000 or 3,000 cases only. And the data showing the increased rate of uptake, and this is because of the approach that involves the community. The national guidelines and targets are also in place as a result of these data. Next, please. Just another clearer example where we compare the two approaches, and to highlight the importance of community or KP-led sites that allow the increased uptake of PrEP, and that's why ongoing advocacy is so important. It requires a strong partnership also between the government and public sector and CBOs, and it also illustrates the kind of data that are useful for advocacy. So we use this kind of data to advocate for the inclusion of the USC. We use this to advocate for HIV financing in the country, and also advocate for the implementation of task shifting policy, which is a key principle, and it needs more acceptance for implementation because it's received a lot of resistance from the health professionals, and I would talk about it later in a later slide. Next, please. So here is the evolution. It has been easy. We started off from engaging in research in 2010, and then in the middle we engaged in developing an implementation science in order to develop data and evidence that can help community-based organizations to advocate at the national level that they are the one who can reach the most at risk more than any other people. So that began in 2014. So we are now have been implementing what is called the Princess Prep. It's an implementation science in community and government clinics. And it's called Princess Prep because the Princess of Somsawali in Thailand has been supporting and using crowdsourcing donation to support the purchase of PrEP. So people under the program are provided with free PrEP since 2016, and this is why it increases the uptake of PrEP quite significantly in the country. But in order to scale up, we need more. Next, please. So this one, this slide, I'm showing you some example in terms of advocacy for self-testing policy. So WHO published the guidelines on HIV self-testing and partner notification in 2016. People were worldwide accepted it and thought that we should scale up. But people accept it doesn't mean that the action will be undertaken. In Thailand, self-testing policy was not endorsed. It needed to be revised in order to accommodate the key population-led services and the assistance that can be provided by the community to do self-testing in the public in order to increase access to HIV testing. So in 2016 and 2018, USAID linkages program, FHI 360, started with research to generate the information and data again to inform policy development, HIV testing policy and guidelines. So just recently, in April 2019, the Thai Ministry of Public Health officially approved HIV self-testing for use in the country. We are still waiting for companies to register for the test kits to be made available, legally available in Thailand, and that we do not have to import from outside. And all of this are not happening in a day or two. You can see that it has taken us almost 4 to 5 years in order to advocate for this, and we need a lot of evidence to support so that the public and the governments can be more comfortable in accommodating the idea of having access, or public to have access to HIV self-testing will do no harm to the public. So we generate a lot of information on any adverse effect, for example, the acceptability and feasibility of HIV self-testing among the public, among key population, and those results have been positive. So how do we do this? So it's really up to partnerships that we have. We have to work very closely with the national government officials. We invited them to be part of the research protocol, and we have implemented this with the community-based organizations in the country. And we also work with the Global Fund by ensuring that the Global Fund proposal in Thailand also included self-testing targets in their proposal, so that we have the alliance to move toward the self-testing policy. And this has helped to improve environment, particularly in terms of policy elaboration and legal frameworks for community HIV self-testing. To do this also, we also need to do community capacity building towards for them being accredited for providing these increasingly clinical services. We need to have ongoing dialogues and advocacy with the medical health professionals and FDA in order to come to the finalization of the policy. Next, please. Here is an example of the advocacy for domestic financing commitment for particularly civil society organizations. So since 2000, 16 as well, the National Health Security Office has made an announcement that $6 million per year will be made available for civil society organizations to do HIV prevention, which focuses on key population, being MSM, TGs, and people who inject drugs largely. And along the line, PEPFAR and Global Fund joining the same policy in order to support countries to transition for domestic financing. The government, the Thai government itself, while having the commitment to do this, the problem is they did not have the process and mechanisms to support civil society to receive direct funding from them. So we worked with the Thai Red Cross AIDS Research Center and CBO champions, being Rainbow Sky Association and Swing Foundation and M Plus Foundation, who are the very strong advocates for the key population themselves, and also they are at the forefront at the policy development in all areas for the HIV response in Thailand.
Hi Ravipa, if you could wrap up in the next minute.
So it really takes the community champions and the national government to work together in order to reach the increased domestic financing. So here I show you the results. So we have improved the system and legal frameworks for enhancing contributions of a KP community-based organization. To see the graph that's been increasing, the red one. What we need to do is to ensure that these organizations can continue to be accredited to reimburse directly the money from National Health Security Office. And then we're waiting for the PrEP universal inclusion in the universal health coverage. Next, please. Next. Yeah. So here are the barriers. I will be repeating the former speaker about the issues that why countries are at different places when it comes to HIV scale up, task shifting, and sustainability. The transitioning from external to domestic financing has been constrained by the lack of political will, stigma and discrimination within the government itself, the lack of ownership, and the stringent registration criteria, and the lack of CSO accreditation, and the lack of capacity. Data are very limited on how money is being spent as well, whether interventions are efficient or not. It's not very well noted. And there's also resistance from medical health professionals in order to allow community-based organizations to do HIV service provision. Next, please. So advocacy approaches and will need to involve multiple activities. I've talked about data so many times. You really need to have research, publications, and data in order to support your discussion and argument and advocacy with the government. They may disagree with you, but when they see the data, they cannot really argue and drop you from the discussion. We need ongoing policy dialogues with high-level government officials, and the use of media and the use of social media by key population themselves really help, because it keeps coming on a daily basis. Before you know it, it already familiarizes you with their programs. So keep on doing it. The events such as the national and international conferences also help. We were really successful in Amsterdam in presenting our data and programs in order to bring about increased support from PEPFAR for the programs in Laos and Thailand. We need the voice of the community-based organization and key populations, certainly, for them to be supported, to negotiate with a national level counterparts and partners. And finally, we need a tailored strategic approach to address the barriers and bottlenecks. Next, please. So here's the conclusion. We need to have that engagement and leadership to express their wills and concerns. And we need partnerships with UNAIDS, WHO, Global Fund, and IAS to come together and speak the same voice when it's come to scale up, when it comes to health financing and other policy developments. We also need local champions. Thailand is lucky to have like the Princess and to have Professor Papan at Thai Red Cross to be the leaders that can help influence a policy change. Please find one in your country, and then that will make your life much easier. We need research and use of data for influencing and capacity building and the use of social media. Thank you.